Thank you for the reminder. So welcome everyone. I hope you're enjoying your Friday. And we also completely understand this is lunch hour. So please feel free to take care of yourself as you need in the space. You want to have lunch, grab a snack, have some tea, whatever you need to do to be taking care of yourself in this space. Again, you're more than welcome to. We are very, very excited to have everyone in the room, and I see people already introducing themselves in the chat. Please keep them coming. Tell us where you're joining us from and what you do. Honestly, this is some of our favorite times just to get fantastic ROR GNY champions in the room to connect with each other. And we even have fantastic updates that we would love to share with you. So this is very much a time for reconnection and interaction. This is our first town hall for this fiscal year. So it's been a minute since I've seen everyone, and I'm just really excited to get to see everyone today. So thank you again for joining us. We're monitoring the chat, seeing everyone coming through, but would also love to get started. Have fantastic ROR GNY team members on the call here. So why don't we get started with a brief introduction? I know we've met some of you. You might have had phone conversations with us, virtual site visits, lots of emails. I know our names come through to support you, but also our team expanded since we last spoke on our last town hall. So this is one of the highlights that we want to share with you today, because our team expansion means that we get to serve and support you more extensively. And we're really excited for you to see all the faces, all the names, and for us to get to meet you as well. So just very briefly about myself, I am Nardine Kell. I'm Senior Associate of Medical Engagement and Data Analysis. I do all things supporting sites, training medical professionals, lot of progress report work. So hooray for all of us for making it through the July progress reports. The last reporting cycle actually closed October 1st, and we closed strong at 84%. We look forward to get to that 100% as we support all of you. So progress reports come up and emails from us come up as well. So I'm sure you might have seen my name quite a few times in the past couple of months, but I'm very, very honored, excited to introduce the rest of our team members. I think I'll pass it off to Carrie, because I know you've seen her before as well. Before we give it off to our very exciting surprises today, Jessie Lizieu and Patricia Phillips. But if Carrie is on right now, we'll happily, and she is, and on mute. So Carrie, please take it away.
Thanks, Nardine. Hi, everyone. Lots of familiar names and faces. Carrie Kurjak. I am the Senior Manager of Literacy and External Affairs with Reach Out and Read of Greater New York. I've been here for about 2.5 years. And happy to continue serving all of you as extraordinary site providers of the Reach Out and Read program. My role has shifted a little bit. I'm doing most of the book ordering, connections to other early literacy supports, as well as our work with coalitions like Cities First Readers and the Reads Coalition. So always happy to interact with any of the above and support you in any way that I can. And then I guess I'm happy to pass it off to one of our new team members, Jessica Lizieu.
Yeah.
Thank you so much, Carrie and Nardine. So yes, my name is Jessie Lizieu, and I'm the Senior Manager of Medical Engagement for Reach Out and Read of Greater New York. I probably talked to a few of you via phone or via Zoom. So very happy to be here with you all today. Some of the things that I do in the organization are, of course, connections and supports within the Reach Out and Read of Greater New York sites, training opportunities for medical professionals and site coordinators. So glad to be here. Thank you all, as Nardine said, for submitting your progress reports before the deadline. That was beautiful and amazing to see all of those percentages. So thank you all. And I'm going to pass it to Patricia.
Good morning. Thank you guys for being here. My name is Patricia Phillips. I'm the Program and Office Associate with Reach Out and Read of Greater New York. Part of my role does include audit tracking, supporting Reach Out and Read of Greater New York with book procurement, the book procurement process, getting those books shipped to you guys, and any donation tracking as well. I also do reach out regarding volunteer opportunities and any partnerships that we have, such as with your public library.
Fantastic. Thank you so much. And I did see our fantastic ED, Emily Marchese, joining earlier. So even though a familiar face, I would love if Emily is able to say hello as well. I mean, this is one of the days we've been waiting for quite a bit of time. If you can't tell, just having the more expanded team saying hello to everyone and us getting to serve you. So Emily, please take it away.
Thank you so much, Nardine. Emily Marchese, I'm the Executive Director of Reach Out and Read. Really excited to be with you all here this afternoon. As Nardine mentioned, we went through a big restructuring so that we could really invest resources and time into supporting the medical professionals, our most important partners in the work. And we're absolutely thrilled to be a bigger, stronger team today and to be learning from you and supporting you as we go. So thank you all so much.
Thank you so much, Emily. So I hope this introduction was just, and you don't need to remember all the names and faces at once. This is just a sneak peek into what's to come and the team that's here to really support you and learn from you about your sites, about the patients you serve, about the fantastic work you do. So again, thank you is never enough, but we're so excited to have you. So I think we can move on just with a brief overview of the agenda today. So we've done a bit of the welcome and introductions. We would love to give a brief overview of some of our fantastic award winners and the annual benefit that just happened on October 3rd. We know some of you were able to join us in the room and others weren't. So Carrie will kind of give us a brief sneak peek into some of what happened. And then we'll go into a reminder of our annual survey that launched last month, and Patricia will also give us a brief overview before we start introducing some of our DI work that has been going on for quite a few months, and we're really excited to gauge your voices, get your opinions on the table, and Jessie will introduce that before our very big treat for the day, and that is having Dr. Joanna Perdomo in the room, who also introduced herself very briefly in the chat, and she'll be talking to us about incorporating DI work into primary care practices. As we know, you all are very passionate about your work, and having those experiences are very valuable. So absolutely looking forward to a much more in-depth introduction, and we'll also have some discussions at the end. So this is just a brief overview of the agenda, and we'll happily dive right into some of the award winners and our benefit work. So Carrie, please take us away.
Thanks again, Nardine. So this was our first annual benefit that we've had in 3 years due to COVID. This is something that Reach Out and Read of Greater New York has done in the past for a number of years. This is one of the big fundraising events, is to have an annual benefit, which is an evening event, bring people together and really fundraise for the mission of the organization. So because of COVID, this was all pushed back, but we were very excited to be able to hold this at Tribeca Rooftop on October 3rd. We had a wonderful attendance there. We had about 200 people attend, and it was very exciting that we were able to say that we did reach our fundraising goal. So we'll have some more information coming out officially, but that is, we were very excited with how the event went, and we were thrilled to be able to welcome so many medical professionals to join us that evening, including the award winners that we had here to celebrate the 2022 award winners that were nominated by all of you and by your coworkers and colleagues. I saw a number of those names on the call here, so we have them all listed. Just again, thank you. And it was a wonderful evening to be able to celebrate the work of the program, to celebrate the work that all of you do every day, and especially these award winners. So again, stay tuned for some more official information in newsletters and additional information that we'll have coming out, but just really thrilled to be able to share in that evening with so many people.
Thank you so much, Carrie. And I love to use this as a reminder of this happens every year. So whenever this comes out to you, please share it wide with your network. We love hearing about the fantastic stories of the work and dedication that you pour into your sites. And this is just a small way to recognize your fantastic work. So keep your eyes out. And I think, why don't we shift gear into some more technical reminders of the annual survey? Patricia, please take us away.
So our Reach Out and Read full annual survey was sent out to sites. I do apologize in advance if I've missed anyone. Here attached is the link to the site, the survey. It is approximately 5 to 10 minutes. I did initially send it out on September 21st, and I did send a follow-up email yesterday with the link to many of the sites. So this survey is really important for collecting information regarding the sites, your needs, your preferences. It helps us to track all of that information so that we can include more diverse books, information for the language needs of your site, and book donations, as well as the storage capacity for your site. I do apologize if you hear any screaming in the back. I have a little niece that's running around. Also, this tool is great for just getting information regarding the volunteer opportunities and regarding the medical professional training at your site and your willingness for other training opportunities as well. We do ask that this site could be completed and sent back to us on or before October 21st. Thank you.
Thank you so much, Patricia, and we welcome all little kiddos and pets in the room. So thank you, and please feel free to get that started. So like Patricia said, the survey link is here. Also, if your site has missed it for any chance, if there was staff turnover, that may be one of the reasons you might not have received it. Please feel free to reach out to any of us, letting us know, and we'll happily update those contacts and make sure that you get the survey. But at any times, if you need something, definitely don't hesitate to reach out to us. We'll happily jump into some of the fantastic DI efforts that we have. And again, I'm launching the chat. Thank you so much for all the congrats. And feel free to ask any questions or bring anything in the chat as well. But Jessie, please introduce us to some of the very exciting work that we've been doing.
Thank you so much, Nardine. So before we hear from our amazing guest speaker, we wanted to talk a little bit about some of our DEI efforts within our organization. So Reach Out and Read of Greater New York is setting up tactical goals and embracing qualitative feedback to continue our DEI efforts. One of our many DEI initiatives is our focus groups. Breaker 28, which is an HR and DEI consulting agency, is working with Reach Out and Read of Greater New York to better understand opportunities to support medical providers, site coordinators, with the focus on becoming more diverse, equitable, and inclusive. Why is this important? All of the data information collected will be essential for a strategic planning goals, which is that's coming up. Another initiative that a lot of you are very familiar, and we just briefly talked about before, are progress reports. Reach Out and Read National requests sites to complete biannual progress reports, and this allows, of course, to monitor wall-child visits, how many books are distributed, insurance information, and of course, this allows to being able to provide more diverse books, resources, and more diverse resources as well. Thank you.
Thank you so much, Jessie. And as we always say, this is very much ongoing work. So whenever you have feedback, suggestions, anything, we really, really value your feedback. This is how this program is run, based on the feedback we have from sites. So always feel free to loop us in, let us know how things are going, or if you have any specific suggestions, even if it's not directly in the focus groups. But this really ties us in very, very nicely with our topic and guest speaker of today, who is an absolute treat, Dr. Joanna Perdomo, and simply not only because of the DI work, but because we're going to hear from a fantastic pediatrician in the room who's deeply passionate about the communities she's been serving and sharing those experiences with the fantastic people in our ROR GNY network who truly inspire us every day and how they serve their families and meet those needs. So I was initially going to do a very humble introduction, but then I saw that Dr. Perdomo has a beautifully colored map of a bit of her journey and where she comes from, and the full circle. So I will happily give it to Dr. Perdomo to introduce herself and talk to us a bit about her work, and some of the things that, you know, people hopefully can take away today, reflect on, and we can even, you know, start cultivating or further cultivate in our New York sites. And this is really a space of interaction and brainstorming. So please feel free to let us know in the chat if something similar is happening in your site, or this is really cool and you want to learn more. And there will definitely be a discussion section at the end where everyone will be invited to ask questions and have fantastic conversations with Dr. Perdomo. So Dr. Perdomo, without further ado, please take us away.
Thanks so much, Nardine. Hi, my name is Joanna Perdomo. I am a primary care pediatrician. I'll go through a little bit of where I've been, but I'm currently located in from Miami, Florida. I work at Nicholas Children's Hospital. Hold on, one sec. Thank you for driving the slides. I'm really delighted to be here today talking about DEI work as a primary care pediatrician. And, you know, I want to start by saying that I am by no means an expert, and I'm sure there are many here today who are doing far more than I am. I think we all bring so much talent, so many perspectives into the room. And so while I'm honored to be here talking about what I've done and some of my interests and hopes today, I'm really excited also to learn from everyone as well. So I'll start by telling a little bit about me, and maybe through this why and how I came to be here too. I was born and raised in Miami, Florida, started there on the map. I was born to a dad who immigrated from Cuba. My mom was born in Miami. She's Jewish. I identify as a white woman. I use she, her pronouns. Identify as Latina as well. So that's kind of my lens of the world. Growing up in Miami, not dissimilar to New York City. It's a very diverse city. And I grew up really surrounded, you know, fortunately, I think in grade school by people from all different parts of the world, speaking all different languages, and kind of just thought that was the norm. And it was really, I think, a privilege to grow up in that environment. I then went, you can go to the next slide, to college at Washington University in St. Louis, where I really, I think, appreciated so much more that diversity that I had in Miami once being in a city that was a lot different, was my new home. But also grew, you know, as a student, as someone who really was dedicated to service as well. After that, I loved the Midwest so much that I went to medical school at the University of Chicago, Pritzker School of Medicine. There, I think just as much as I learned how to be a clinical doctor, I really learned how to think about community health and public health. University of Chicago is located in Hyde Park, which is in the south side of Chicago, which, as some of you might know, is a more underserved area, and had the opportunity through medical school to do a lot of really amazing community partnerships, work with high school students to build public health projects, and learn so much from the people around me about them, about community health, and about the type of physician I wanted to be. So, and my next step of the journey, because I just couldn't get enough of the cold, I went to Boston for residency at the combined program between Boston Medical Center and Boston Children's Hospital. I was part of what was called the Urban Health and Advocacy track, what is now called the Leadership in Equity and Advocacy track there, which was a really fantastic opportunity to do pediatric residency while also having time, space, mentorship to delve into topics related to health equity, diversity, inclusion, and you know, have the time and space to do that as well. I stayed on after, go back, moving too fast. No, I'm kidding. I stayed on after residency to do a general academic pediatrics fellowship at Boston Children's Hospital, and got a master's in public health during that time to really hone some of my skills in developing community-based programs. And I was able to be the director of our leadership and equity and advocacy track in the residency program as well, and mentor so many fantastic residents through there. It was there where I also had the great fortune to meet and work with Jessica Lizio from Reach Out and Read. And I've been so honored to be her colleague and friend, and to be here today speaking with you all. So closing the loop, I, about a little over a year ago, made the move back home to Miami, largely motivated by this little girl here. It's my daughter, Rosie. All my family has been down here, and as you know, you all know, whether your parents, friends, pediatricians work in the healthcare system, it takes a village to raise children. And so I wanted to be near mine. And so we've come back to Miami, where now I'm a pediatrician at Nicholas Children's Hospital. Click next. It's the only freestanding children's hospital in South Florida. I work in our primary care clinic, both at the hospital and also at clinic sites in our community as well, which are scattered throughout the community, and have had the opportunity to also do some DE&I work here. So that was my whirlwind tour, but I think important when we talk about a topic like DEI to sort of understand where we all come from. And I would love to hear more from each of you and wish we had time to go through all of this for everyone here. But that is where I've been. You can move on to the next slide. Thank you. So today, in our brief time together, I really just want to share a few highlights of my D&I work as a pediatrician through 3 different initiatives that I've been involved with. The first is called Health Equity Rounds. The second are virtual toddler group visits. And the last is through food insecurity screening. So I'll go through these a little bit. I want to leave plenty of time for Q&A, and that's that. So first, we can move on to Health Equity Rounds. So Health Equity Rounds is a program that's a case-based longitudinal conference series to discuss the impacts of racism and implicit bias in clinical care. I launched this with some colleagues at Boston Medical Center in 2016 during my time in residency. And since then, it's continued at BMC and has been adopted by over 60 institutions nationally. And I looked at our registry, and there's actually a few New York sites who at least we've spoken with about interest. Some of you might have heard about it. I think there's NYU, one of the SUNYs, Mount Sinai Morningside West, and Cohen Children's. I don't know if these are all within this purview of this call, but just wanted to give that New York shout out. And so you can move on to the next slide. I want to describe a little bit is that through these conference series, we work to identify and analyze the effects of implicit bias and structural racism in specific clinical scenarios, describe the historical context and present-day role of structural racism and its impact on the healthcare system, employ evidence-based tools to recognize and mitigate personally held implicit biases, and use our newly learned strategies to combat structural racism at the institutional level and reduce the impact of implicit bias on patient care and interprofessional relationships. So how do we do this? We can move on to the next slide. So the format of Health Equity Rounds are sessions that last ideally at least 45 minutes. An hour is great when the time is available, and occur in spaces ideally more than one time a year to provide ongoing dialogue around these really important topics rather than just be a one-time occurrence. We've had Health Equity Rounds in person was the way it started, but virtual is the way that they've been going for a while in many settings successfully. And during health equity rounds, we invite and I wouldn't say require, but I think there's stronger discussions when you can have presenters and definitely audience members from multiple disciplines, including from outside the place that you work. So on the right is a little bit of a walkthrough. I don't have time to show you an entire presentation, but a walkthrough of how health equity rounds might go. So you might spend a little bit of time introducing some key concepts. If a talk like this is very new in your setting, even spending time defining what is racism, what is bias, doing some introspection and self-reflection. We then move on to presenting a case as the basis for discussion, ideally a case that has happened within the space that you work to really bring it home. We then move on to talking about historical and present day context that informs what happened in the case and the larger issue at hand. And then we end with action items for what one can do on a personal level, on a workplace level, on a state, local level, national level, to work against the different types of racism and bias that are being discussed and the different structural factors. You can move on to the next slide. Health equity rounds has been delivered in a variety of settings, and I know there's people here who are clinical. I know there's people here who are site coordinators, people who might work in, people who work at Reach Out and Read, Greater New York. And I think there's a space for the health equity rounds program and format in all of these places, just to give examples of where health equity rounds has been delivered in public health departments, talking to the department itself as part of their ongoing education, in grand rounds in a department, at noon conferences with residents, in primary care clinics with people from across the entire staff at the clinic during a noontime lecture, and even in staff huddles for both outpatient and inpatient settings. This format can be applied in various ways. Some topic examples of things that we've covered through health equity rounds are listed here. Disproportionality in school discipline, microaggressions in the workplace, utilizing stories that people have experienced themselves and have shared, reproductive justice, vaccine hesitancy, racism and bias in the electronic health record, and many, many more. I can move on to the next. And so if this is piquing your interest, and I know some of what I'm able to cover right now, it might seem a little bit abstract, but more than happy to talk more after this. But what do you need to start? So first you need some champions to start this and to put the work into actually making these presentations. Support from leadership, maybe bullets 1 and 2 are one and the same, but if they're not, making sure that you have the support from leadership in your institution to both provide you the time to create this material and engage in this work, and also the time for all of your staff to learn. And then an engaged audience is critical, ideally from multiple disciplines. You can move on to the next. So in terms of starting too, I think it can seem sort of daunting to create a whole new curriculum, but my colleagues and I have published a Med-Ed portal publication, which is an open access online journal that allows us to really describe and provide examples of our curriculum. So in this publication, there are 7 full cases, full PowerPoint presentations that are completely annotated. So if you're like, what is this all about? You can go in there, you can open up the PowerPoints, you can look through the notes and understand a little bit about how you might facilitate a discussion like this and how you might tailor it to your institution. And I am so happy to connect with anyone after this about this as well. I'm going to move on to The next kind of program or project that I wanted to mention as it relates to DEI work in primary care pediatrics, which is toddler group visits, which I'm going to cut to the chase and also shout out Jessica Lizio, who was my partner on this initiative when we were together at our community clinic in Boston. We developed this virtual group visit for 2.5-year-olds in the height of the pandemic. And really it was developed in response to challenges that we saw our families were facing. Isolation, health and safety concerns, especially regarding taking transportation, public transportation, often required to come to clinic. But within this, within this atmosphere, the need for continued developmental surveillance and the desire for community to combat this social isolation. Many of the families in our community clinic were from minoritized communities, and many, were feeling this isolation really deeply during the pandemic and had a lot of concerns about bringing their kids to the doctor. So we created these visits on Zoom, which, as you can see in this picture, they were a lot of fun to have, where we, Jessie and I collaborated, myself as a pediatrician, her as the early intervention provider, to have 4 to 5 families at a time have visits with us. We did visits in both English and in Spanish, where we did developmental assessments through a lot of creative games. I'm going to shout out to Jessie for doing all of the creative games and interactive virtual engagement. I would conduct a brief medical visit in a Zoom breakout room. We did social needs assessments and connected patients to social work through the visit. And really, I think the most probably valuable thing through doing these time and again was providing kind of an open forum for parents to talk to us and talk to each other about challenges they were having, about ideas for how to engage their kids in learning and development, when there was a pandemic raging outside. And although the pandemic has stopped, there still is certainly a role for this. I think these visits, since Jessie and I both left, have had paused, but they're actually restarting. I think speaking to the importance and need for this type of group support in this really critical age group of toddlerhood, where development is so critical to be surveyed. So that was really one big and fun project that I think hopefully might spark interest in some of you all, and or you might be doing really similar or even more cool things than this that I'd love to hear about. You can go on to the next slide. And so the final thing I wanted to mention as far as programs is now in my new setting in Miami, is applying some lessons learned from other places to new settings and doing food insecurity screening. I'm sure that many of you on this call have been screening for food insecurity and doing a lot of robust work in this space for a long time. I know that I was fortunate to be at institutions previously that had been doing this work, and I had learned a lot from them that I was able to bring down here, where this work at my new institution was just starting. And so I've been able to get on board with starting hospital-wide efforts to screen our families for food insecurity and provide community resources, and help work to expand efforts to clinical spaces, enhance community partnerships, grow on-site resources, and educate our staff. So kind of taking those lessons I learned into a new place. Next slide. And this is my last slide here. I just wanted to close by just with some reflections on how to incorporate D&I work into a busy schedule. Some things that I think have been helpful for me are getting involved in local and national groups and committees. you know, there's so many of them out there. The AP has several DNI groups. There's other organizations that you can partner with that are in the healthcare space, outside of the healthcare space, that just help generate ideas. Reach Out and Read, of course, is one of them too. Collaborating with multidisciplinary partners. I think that I found that in all the work I've done that I talked about here and kind of just continue to do, whenever I'm working with someone who's not a physician, I feel like the project is always stronger. And so whatever role you're in, I think just I would encourage you to look outside, look to people who are not in your same role as a partner. I think that for me, staying grounded in relationships and work with patients and families has always been sort of my like North Star in terms of finding inspiration for work, learning, and growing. And then lastly, and this is a quote from a friend and colleague, Camilla Mateo, who is in Boston. She's a leader in a lot of anti-racism work, is to remember that DEI work is not extracurricular. While often it is framed that way, or, you know, you're on the DEI committee or doing the DEI this or the DEI that, really, it's something that can and should be woven into the fabric of every day. And I think having, you know, that framework can help it feel more approachable, less daunting, and also, you know, if it's woven into how you live your life, how your organization strategizes about what they do, then it's just going to make the work natural. And so that's really all I have to share right now. I am happy to take questions, and like I said, to learn from all of you about things you're doing too. My email address is up there. I'd be more than happy to chat offline as well. And because this is Reach Out and Read, I couldn't help myself but put a picture of my daughter at the library, enjoying the children's section. So that wraps that up, but yeah, happy to go from there.
Our favorite happy place. Thank you so much, Dr. Perdomo, truly for all the experiences shared. And we're so lucky to have time for discussions and questions. I mean, as you're talking, there's just so many parallels that are even speaking to me, but I want to give everyone some time to marinate some thoughts and questions, and maybe even share kinds of initiatives that happen at your site for thought partnership for other local clinics. I mean, one of the most inspiring things working with Reach Out and Read of Greater New York during the pandemic was really seeing how much people were going out of their ways to do everything possible to support their families, make sure that their families, you know, still find that tiny space of community that was very challenging. But even it could be through the one book they get in the Well Child Visit, or the conversation that families are having about, you know, the healthy development of their child, and feeling that that's the highlight of the room. That's all that matters. And these connections, like you mentioned about the relationships, are really key to the work that everyone in this room does. So it's always humbling and very exciting to hear from everyone. But happy to hear from people about their experiences, any questions you might have, or just sharing some of the cool ideas you implemented. I mean, I was looking at the photo with the furry animal in the background, and I'm like, I want to be that kid in the Zoom meeting, getting to meet my pediatrician and everyone that way. So it's just so exciting to see the innovation that came out of that challenging time. But thank you again so much for all the sharing. Fantastic. Pulling up chat here. Make sure I'm monitoring. Also, feel free to unmute yourself to ask any questions, and we can put the email here as well.
I would be curious too to ask our audience if there was anything that they heard today that they liked or would like to implement, but don't have the resources currently or don't have the capacity, the staffing, whatever it may be. And, are there pathways that Reach Out and Read of Greater New York could help with that or support with that? And then Joanna, maybe if you would share something where if there was a particular effort that you made that was more challenging than others, or a time where you had to kind of overcome whether it's a logistic obstacle or just getting buy-in, and maybe share what that was like for our audience.
Yeah, absolutely. I'm happy to chime in as people maybe think through your first question. But I think, initiating large scale conversations where you talk about racism is inherently challenging. I wish it wasn't, but it is. And often for, approaching people in leadership about doing this, especially I was doing this as a trainee, wasn't always met with the immediate acceptance. I will say initially when we did start it, we were in an incredibly supportive environment where our department chair really championed the work. But not all of the faculty were on board as we started talking about these topics and kind of really pushing people to think about their own biases and their own experiences where they, might have done things that are uncomfortable to think about in terms of perpetuating racism. And so I think that being persistent was important. I think ensuring, as I said before, that up front we had dedicated space and time to continue these conversations so that even if the first one was a little shaky, we'd have the opportunity to share this material again and again. I think creating safe spaces as much as possible and just having people understand that this was an environment for learning and growth and not for finger pointing is important too. But yeah, it's certainly not been an easy path always, but one that's been worth it.
I love the highlighting of persistence. And I'm sure it will echo with a lot of people. And we have one question from Dr. Olsen here. Happy to read it, or also Joanna, if you want to read it and take it away.
Yeah,
very interesting.
Thank you for this question. So have you found that implementing standardized bias screening tools and discussions of findings afterward, has this been awkward and how has it been handled? We haven't, or at least through health equity rounds, we haven't implemented bias screening tools. We have done evaluation sort of around what are people's, perceived levels of implicit bias. Do they think implicit bias impacts and racism, do those impact them? Do they think it impacts their interactions with colleagues and with their patients? And then asking people, do you discuss implicit bias and racism with your colleagues and patients? And we presented and discussed those findings sort of in aggregate. So I think I'll say, I think asking these questions, I think has been important, because then when you discuss them and show the results, it sort of disallows people to say, oh, that's not me, or this doesn't happen here. So asking some of these questions has been really key to having buy-in from people who might say, this is not at X place, we all are unbiased, no one is, right? So asking some of these questions, I think, has actually been helpful. Sometimes, and some of the questions I mentioned, we asked those specifically. I implemented health equity rounds in my primary care clinic. And we asked these questions of our whole staff. And some of the answers were really enlightening, and sharing them with people was enlightening too. Whereas people, reported that they, they understand there's implicit bias, they understand there's racism. They say that it's important, but then they're not talking about it with their patients and families. So we could sort of tailor, where are the interventions, where should we talk about more, where should we push ourselves a little more as well. I'll say a third piece on this is that, and this is kind of a little bit of a tangent to your question, but I think important, is that I mentioned that the cases that we like to center each health equity rounds on ideally come from the institution or place that you're at. Again, so that people can't say, oh, well, that happened there. This didn't happen here. This is a fictionalized case, but actually saying, oh, this happened here. This happened to me. This happened to my colleague. This happened to my patient, has actually helped, I think, center the discussions and not allow for people to say, tune out.
Fantastic. Thank you so much. I don't see more questions coming in the chat. I know it's a bit of a topic that at least calls for reflection and for people to take the time to really think about those things. And thank you so much for sharing your contact info. So anyone, please feel free to reach out to Dr. Perdomo if you have any follow-up questions. I have to say, at least for me, just thinking more holistically about and intentionally about the approaches we take, and also being very grateful for the work that Reach Out and Read of Greater New York now doing with the DEI focus groups. So your experiences and your patients' experiences are really powerful in informing how anyone moves forward, whether it's organizations, systems, and that's exactly the multidisciplinary piece that we work with. We know we are not the physicians in the room or the medical professionals or the site coordinators, but we work in collaboration with you. So again, want to acknowledge all the hard work that goes into this program and that you deliver to the families. So thank you. And we're always here to listen to feedback, to learn more about experiences that happen at your clinic or things you think that can be done for us, like Emily mentioned, to be more supportive. Is it resource limitations? Is it messaging? What can we do to really help support the fantastic work that you already do in your workspaces? So thank you so much. And I know we have a few more minutes, but I'm just looking at the chat and I would love to remind everyone, because we know everyone's time is very limited, but we have the link for the annual survey. So please feel free to take the gift of a few minutes of your time back if you can to start that survey. It's really crucial to help Carrie and Patricia and our wonderful book procurement team to get the updated information to get more books to your sites, which is our favorite part of what we do. So again, thank you so much to everyone. And if no one has questions, we're happy to give you back a few minutes of your day. But thank you, Dr. Perdomo, and thanks for the team and for everyone for joining us today. Thank you.
I don't have a question, but I would like to say something.
Of course, Francine.
Hi, everybody. I just wanted to say happy Friday. It was an honor and a privilege to be in attendance with all the nominees and all the great people who attended the Reach Out and Read banquet. Reach Out and Read is one of my passions. I am an early literacy coordinator at BMS Family Health and Wellness Centers and a Reach Out and Read ambassador. But literacy has been a passion of mine since I was a little girl. And I never went to school for it, but somehow literacy ended up being in my work frame. So this is amazing. You guys are my biggest supporters and sponsors for everything that I'm able to do. So if it wasn't for you guys, I wouldn't be able to meet people where they're at every time they come into the clinic. It allows me to build relationships and partnerships with other people outside as well. But you guys are amazing. I rave about you all the time, and I just couldn't go without wishing you all a great weekend, letting everybody else know how amazing the Reach Out and Read benefit was. I got some Jets tickets. But otherwise than that, you guys are amazing, and I appreciate you, and I love to see your faces all the time. Thank you.
Thank you, Francine. We appreciate you and appreciate everyone in the call. I mean, truly, this work wouldn't be possible without all your dedication and hard work. So thanks again to every single one of you. Thank you.
I'm happy to quickly jump in about the question in the chat about the books. We have recently secured a order that will be hopefully shipping early November. It's a bit of a smaller order from All About Books.